Hello, today we're demonstrating the screening neurologic examination. The screening neurologic examination consists of cranial nerves, which include the fundoscopic examination of the eye, motor testing, sensory reflexes, and coordination and gait. We'll start out with the cranial nerve examination, starting out with cranial nerve 1. So for cranial nerve 1, the olfactory nerve, we don't actually test. We'll screen by asking the patient, do you have any difficulty with your sense of smell?
I do not.
Okay, cranial nerve number 1. So cranial nerve number 2, we're going to start out with visual acuity, then visual fields. To test visual acuity, you use the eye chart, and this one's designed to be held 14 inches away from the eye. You want the patient's best corrected vision, so if the patient wears glasses, have them wear their glasses. I'd like you to cover up one eye, and can you read this line here?
937826.
Can you read that line?
428739.
Very good. So she has 20/20 vision corrected in that eye. Let's try the other eye. How about this line here?
937826.
And here?
428739.
Very good. Now 20/20 vision both eyes. So next we'll check visual fields. And the way we check visual fields is by confrontation. I'm going to check my visual fields versus hers. And the way we do that, I bring my fingers out of her visual field into this plane between us and test my visual field against hers, one eye at a time, and you want to go around the compass, north, northeast, etc., around the compass for both eyes. So I can cover one eye, and I'm going to cover my eye here, and I want you to tell me when you see my fingers move. Okay, so I'm out of her visual field, and I'm bringing to this plane between us, and coming down.
Now.
Okay.
Now. 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 Now.
Leave your hand there. Now I have to test the other side of the compass. Tell me when you see my fingers.
Now. 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 Now.
Okay, let's try the other eye. Same thing with the other eye. Tell me when you see my fingers move.
Now. 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 Now.
I'll leave your hand there. Tell me when you see my fingers move.
Now. Now. Now.
All right, good. So that's visual fields. The visual fields are good. And next we're going to check extraocular movements and the accommodation reflex. The patient can have their glasses on or off for this maneuver here. Leave the glasses on if you like. Follow my finger with your eyes and don't move your head. So I'm going to draw an H here. I'm going to cross over the H. Up and down. So for the accommodation reflex, I'd like for you to follow my finger. Keep it, focus on it, focus on it. And what you'll see is the eyes will cross and the pupils will constrict. The lens is accommodating for near focus, but we can't see that. So next we're going to check the pupillary light reflex. And let's have you take your glasses off of that. You can dim the lights for this maneuver if the pupils are small. If not, you can leave the lights on regular. Any light source will do. I'm going to shine the light in one eye and watch that pupil constrict, and then watch the opposite pupil constrict. I'm going to test the other eye. And both pupils constrict evenly. The next test we're going to do is called the swinging flashlight test, where we look for an afferent pupillary defect. This is usually seen something going on in the optic nerve, like optic neuritis, which can be seen in multiple sclerosis. And what we'll notice with this is when we swing the light back to the affected eye, the pupil will paradoxically dilate. So I'm going to assess the right eye here. I'm shining in the right eye. I'm going to go quickly over to the left eye and then back, and the pupil's still constricted. I'm going to test the other eye, swing back over, and the pupil's still constricted. So that's the swinging flashlight test. So thus far we've checked cranial nerve number 1, 2, and with the extraocular movements is SO4LR6, 3. So the next part of the examination, the eye is going to do fundoscopic examination, which is important for the neurologic exam. So, can you hold that for a second? For the fundoscopic examination, you want to darken the room. And I'm going to turn the lights back on so you'll be able to see it in the video, but make sure you darken the room so the pupils will get more dilated. And with the fundoscopic examination, have the patient remove their glasses, and you can remove your glasses too because this has a number of lenses in it. You need to adjust the rheostat on this so it's not really bright to hurt the patient's eyes. Set the diopters on 0. Use your right eye for the patient's right eye and your left eye for the patient's left eye. What I like to do is put my hand on the patient's head so I won't hit them inadvertently because you have to get kind of close. Start out about 15 degrees. You'll see the red reflex, and then swing in right in front of the patient. Now you want to try to focus on a blood vessel. Once you find a blood vessel, look towards the center nasally and you'll find the optic disc. So take a look at the optic disc and then move your light source and look at all 4 quadrants of the retina. Next you want to try to look at the fovea and the macula. That is temporal to the middle of the eye. Can you look right at the light? Good, now look back away. If you have the patient look right at the light, they'll put the macula right underneath your lens there. Then you're going to click these to the more positive, the diopters to the more positive, and look at the anterior chamber of the eye. Same thing for the other eye. Dim the lights, ask the patient to pick a focal point. Set this at 0. Have you look up there again. Come in at about 15 degrees. Swing around right in front of the patient. Find the blood vessel. Focus. Find the optic disc. Then look at all 4 quadrants of the retina. Look temporally for the macula. Look right at the light, please. Okay, you can look away. Then focus to the positive lenses to look at the anterior chamber of the eye. Thank you. So that completes the eye examination. So the next cranial nerve that we haven't covered is 5, the trigeminal nerve. And the trigeminal nerve has both sensory and motor functions. So for sensory function, we're going to test both sharp dull, also known as pinprick, and we're going to also test light touch. So for the sharp dull, I usually will break a Q-tip, get a little point on the stick here, and ask the patient to shut their eyes. And I want you to tell me, I'm going to touch your face with this, is this sharp or dull? And so I always use sharp, and see if they tell me if they feel it as a sharp sensation. Sharp or dull?
Sharp, sharp, sharp.
In all 3 divisions on both sides of the
Sharp,
face.
sharp, sharp.
Okay, you can open your eyes. Next we're going to do light touch, and that's best done with a cotton ball. Okay. I'm going to touch your face with this little piece of cotton here. I'd like for you to say touch when I touch it. Can you shut your eyes?
Touch, touch, touch.
All 3 divisions.
Touch, touch, touch.
Okay, you can open your eyes if you like. Now we'll do the motor division of the trigeminal nerve. We'll check the masseter muscles. Put your hands on the patient's face. Can you bite down for me? And you can feel the muscles contract. So we've done 1, 2, 3, 4, 6, and 5, but we haven't done 7 yet. 7 is facial, so we do some muscles of facial expression. Have you wrinkle your forehead? Good. Shut your eyes real tight. Now let me open them. Good. Have you puff your cheeks out, and then show me your teeth. Okay, so that was the facial nerve. And so next is 8, the acoustic, and so we're going to test hearing. Have you shut your eyes and put a finger in one ear. I want you to tell me when you hear my fingers rub together.
Now.
Good. And switch. Tell me when you hear my fingers rub together.
Now.
Good. So 8 is good. So next is 9 and 10. So to screen for 9 and 10, we just watch the palate rise symmetrically. You don't need a tongue depressor for this if you can see the back of the patient's pharynx there. Open up for me, please. Say ah.
Ah.
All right, good. The palate rises symmetrically. Next is spinal accessory number 11. So we're going to check shoulder shrug. Lift your shoulders against my hands. Good. Turn your head this way. Good, and this way. Next is cranial nerve number 12. Let me have you stick your tongue out. Now put your tongue in your cheek and push out. You actually push against the tongue here. The other side. Okay, good. So that's our cranial nerve examination. Next is motor, and this is a screen for weakness. And what we're going to do is check proximal and distal muscles in the upper and lower extremities. So let's check out the deltoids here. Hold your arms, don't be pushing down, okay? Good. Put your arms like this, don't let me pull back. These are the biceps. Good. Push out against me here. Triceps. Triceps. Put your hands back like this. These are the wrist extensors, don't let me pull down. Okay. Good. Intrinsic muscles of the hands. Can you put your fingers out like that? Don't let me push them together. Don't let me push them together. The next is hand grip. It's best to put your fingers this way. Go ahead and squeeze me real tight. You won't hurt me. Good, good. Okay, so that is the screening motor examination strength in the upper extremities. Lower extremities is kind of the same thing. We do the hip flexors here. Go ahead and lift your leg up against my hand. Good. This one. Good. Quadriceps, kick out for me. Kick out for me. Hamstrings, pull down, pull down. Good. Pull down. Have you push on the gas here. Pushing the dorsiflexion. Sorry, that's plantar flexion, dorsiflexion. Press down. Pull up. And that's our screening for the strength examination, motor strength. We're also going to look at motor strength during the gait part of the examination. So next is sensory, and this is just a screening examination. If somebody has a sensory defect, you're going to be much more thorough in this exam. So all we're going to do is sharp and dull, distally and upper and lower extremities. I have my little sharp thing again. Let me have you put your hands on your lap, and I'm going to test this by tell me if it's sharp or dull. So shut your eyes and say sharp or dull when I touch you.
Dull, dull, sharp, sharp.
Okay, how about this?
Sharp.
Okay, and here?
Dull.
How about here?
Sharp.
Okay, how about here?
Sharp.
Okay, I wasn't pressing very hard. If you do get a dull response, try it again and try to get sharp. So same thing with the little cotton ball again. You notice I'm just doing one distal aspect in each extremity. Have you shut your eyes and say touch when I touch you?
Touch. 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 Touch.
Good, thanks. You may open your eyes. The next part is the vibratory sense, and we use these. This is for posterior columns. We use the 128 Hertz tuning fork. I'm going to touch you with this. Tell me what you feel. So activate your tuning fork by tapping against your hand. Tell me what you feel.
Vibration.
Tell me when it goes away, and you dampen it.
It's gone.
Good. Let's try right here. Tell me what you feel it.
Vibration.
Tell me when it goes away.
It's gone.
Good. Same thing over the feet here.
Vibration.
Tell me when it goes away.
Gone.
Same thing over here. Tell me when it goes away.
Gone.
Good. The next part is position sense. Let's see your hand here. Now I'm going to grab your finger here. Okay. I want you to shut your eyes and tell me if your finger's up or down. Notice I'm grabbing the sides of the fingers. Up or down?
Up.
Good. Let's try the other hand. Up or down?
Down.
Same thing with the toes. Shut your eyes and tell me if your toe's up or down.
Down.
This toe, up or down?
Up.
Okay, and that's our sensory screening examination. Next are the reflexes. And we'll start out with the biceps reflex. So you have the patient relax with their hand pronated in their lap. You find the biceps tendon and press down on the pre-stretch the tendon and just tap. Okay, biceps. Don't forget during the neurologic examination everything is bilateral. Tap. Okay, those are normal 2+ reflexes. Brachioradialis, right about here. Same thing, tap your fingers. Okay. Brachioradialis. Okay. triceps reflex is a little bit more challenging because you have to get the patient to relax their arm. You hold your arm here, let me hold all the weight. You tap over the tendon back here. There we go. Same thing with this arm. Let me hold all the weight. All the weight. Okay, triceps reflex. Patella reflex, you got to find the patella tendon first by palpating it, because you don't want to hit someone in the patella. So find a patella tendon and then tap. There we go. Patella tendon and tap. Good. For the Achilles reflex, you want to pre-stretch the Achilles tendon. And you do that by dorsiflexing and everting the foot. And just tap on the Achilles tendon. Dorsiflex and evert the foot. Okay, good. So the reflexes. And then the other thing that I need to do before I have to lay down to test some of the things in the lower extremities is I need to do a little bit more with the motor of the upper extremities. One is muscle tone. Relax your arm here. With muscle tone, you want to move the arm through all the joints here and feel muscle tone. Okay, that's a normal muscle tone. Let's see you do pronator drift. So put your arms out like this. Shut your eyes. And what you do is just hold your arms there for a second. And what I'm watching for is any abnormality where the patient's arm will drift down and then pronate in. Okay, that looks good. Let's have you lay back. Now we're going to check some of the neurologic examination of the lower extremities. And the first thing we're going to check is muscle tone. So let's have your legs go all the way relaxed. Okay. What I'm going to do is roll the legs and feel the muscle tone. Okay, muscle tone is normal. And next what I'm going to do is put my hands under her knees and kind of jerk up suddenly to feel muscle tone. And normally with normal muscle tone, the heel will not jump off of the examination table. Normal muscle tone. Okay, good. While she's in this position, I can check the plantar reflex or the Babinski. And the way that is done, the legs extended like this, you're going to take the end of your reflex hammer and draw a J on the bottom of the foot like this. And that's the normal response. The toes will kind of curl down. Let's try the other side. For the purpose of your OSCE examination, tell the standardized patient before you're going to do this. They may ask you to describe what you're going to do, and you'll get credit for it because it's not very much, not a very pleasant part of the examination to make somebody go through several times in a day. Next, we're going to do some more of the cerebellar examination. Let's have you take this heel and rub it up and down your shin here. Good. Yeah, do it again, please.
Same way?
Yeah, same way, up and down. Good. Let's try the other one. This is heel shin test for cerebellum, and that's normal. Let's have you sit back up. So some more of the cerebellar examination is finger, nose, finger. Let's have you take your index finger, touch your nose, and touch my finger. So have them extend their arms all the way. Do it 2 or 3 times. Let's try the other hand. Good. The next part of cerebellar examination is fine movements of the hand. You do this. Let's try the other side. And people should be able to do this quickly and accurately. Well, good. So we've done the cerebellar examination. Let's do a little bit more of coordination along with gait. Just have you hop down. And then this is the Romberg test with the eyes open. Let's have you put your feet together. And take a look here with your eyes open. If you're not able to do this, you probably have a cerebellar problem. Now we're going to ask you to close your eyes. And she's doing fine. You can open your eyes up. That would tend to isolate the posterior column. So posterior columns look okay. So let's do a little walking. Let's have you walk over towards the wall there. And turn around and walk back. So this is a normal gait. Let's have you walk tightrope. This is called tandem gait. Walk like this. It's another balance and coordination test. People with cerebellar trouble cannot do this. So they take a turn back around. Can you walk on your toes? This is a test of balance and lower extremity distal strength, and walk on your heels. Very good. Okay. That concludes our screening neurological examination.